In this series, we bring you helpful information to support your well-being and to overcome the many challenges that life can bring. Our aim always is to bring you information or actions to support your well-being that are accessible to everybody. Today, we are going to be discussing the impact of loneliness on our well-being and helpful ways to cope if you are experiencing loneliness. Our guest today is Norman Weininger, Chief Clinical Officer here at Aspire and licensed mental health practitioner with many years of experience working in the mental health field.
Thank you, Yeji.
Thank you, Norman. Everybody knows what loneliness is, but some people might not be as familiar with how prevalent loneliness is in our society and the negative effects it could have on our well-being. Can you talk a bit about how common feeling loneliness is?
You're exactly right. It is common. Let's do a little bit of definition of it first at the beginning here to say that loneliness is a negative state of mind, a negative mood, causes people to feel empty, alone, maybe even unwanted, maybe feeling like that they're shouldering all the burdens of their life alone. And let's make another important point about loneliness because loneliness is not about liking to be alone, because sometimes being alone and enjoying being alone is a very good self-care thing that people do. So that's one thing, and that's positive. But loneliness, rather, is being alone and wanting more interaction and feeling like we don't have a choice in being alone versus electing and choosing to be alone. Now, having said that, as you mentioned, it's extremely common. Loneliness is something we can all relate to. It's also complex, and its prevention can be different and variable from a person to person. In terms of how common it is, there's a lot of research about loneliness, particularly in our post-pandemic world. There's research that shows that a high percentage of people, young people under 18 years of age, report loneliness, which is very interesting in this digitally connected age that we live in. And also, loneliness is very common among the older populations in this country. And there are certain life factors over the course of our lifespan, Yeji, that can contribute to periods of loneliness. That can include issues such as moving to a new location, getting divorced, or the breakup of a significant relationship, maybe, having bouts of depression. Low self-esteem can play into an increased risk of loneliness. And of course, high levels of loneliness are associated with certain physical health conditions. And living alone is another risk factor for loneliness. And having poor quality friendships and social relationships also put us at risk for extended and unpleasant periods of loneliness. So it's very common. And it's sometimes related to our stage in life and to different challenges that come our way in our life, Yeji.
Thank you, Norman. Speaking of health impacts, can you talk about the different ways that loneliness can impact someone's well-being?
Yeah, it's a good point, Yeji, because loneliness is more than just a bad feeling. It can impact us physically and emotionally. And it's, for example, loneliness, Yeji, is associated with increased risk for alcohol or other drug misuse. It's associated with cardiovascular disease and increased risk of stroke, certain decreases in cognitive function around memory and learning. It's associated with the progression of Alzheimer's disease, certainly associated with depression and depressed feelings, and also with feelings of increased stress. Now, all that makes sense because studies have found that lonely adults tend to get less exercise than people who say they're not lonely. They tend to have diets that are higher in fatty foods than people who say they are not lonely. They tend to have reports of poor sleep and reports of more daytime fatigue and tiredness. And there's even research that shows, Yeji, that loneliness tends to affect certain cellular processes within our body and predisposes lonely people to premature aging. I wanted to, in that context, call out what I thought was a very interesting paper that was, a report, I should say, that was published by the U.S. Surgeon General last year, an 82-page advisory, actually, about loneliness. We often think of Surgeon General's reports about being more around medical issues, but he actually called out loneliness as an important and often unrecognized epidemic in the United States. And if you're interested in reading that report, just go to hhs.gov and look for the Surgeon General's report. In that report, Yeji, he cited data that nearly half of adults in this country experience feelings of loneliness each day. And that's a significant number of people and a very important statistic, I think. He also talked about the risk of premature death because of the health impacts associated with loneliness. In fact, at one point, he equated the health impacts of loneliness as equivalent to almost to smoking a pack of cigarettes per day. So he called out the science around the connection that is known between chronic feelings of loneliness and a poor health status. So it's an important issue for us to talk about and to also talk about what people can do to overcome it.
Wow, thank you. And finally, as a last question, Norman, can you discuss some ways or tips that people who are lonely can cope with their loneliness?
The Surgeon General, I think, made some extremely good points about accessible ways that people can address personal loneliness in his report. And they all get around how do we establish more and better relationships if we are feeling chronically lonely. He suggested the simple things such as answer that phone call from a friend, or take the time to make a phone call to a friend. Take time to share a meal with somebody or invite someone to share a meal with you. Listen to other people without the distractions of your phone or some other electronic device. He encouraged people who are feeling chronically lonely to get involved in their community and perform some act of service. And there's many ways, of course, to do that, to get involved with groups in our community. And speaking of performing an act of service, maybe you know somebody who's chronically lonely, and maybe your act of service and kindness can be to reach out to that individual. And finally, he encouraged people to express themselves authentically to others and to listen in an authentic and empathetic way to others. So those are some really simple ways, Yeji, but they're extraordinarily powerful ways because they tap into the great support that we get through social relationships.
Thank you very much, Norman. That is, very important information, and I'm sure everyone learned a lot today. Loneliness is such a common thing in today's society. I think everyone, at least one point in their lives, can say that they've experienced some degree of loneliness. And so I hope that we provided good information and some good tips on how to cope if you are feeling lonely, or if somebody is dealing with loneliness. And with that, we conclude today's podcast.